Envision waking up one morning with full bodily function, but by the end of the day, you've lost movement in your legs and all sensory across your body. For many living with transverse myelitis, this is the very big reality of the picture painted by this disorder. Transverse myelitis is a rare neurological disorder that causes inflammation on both sides of the spinal cord. For this speech I've done much research, but I live with the condition myself. I also used medical research articles and sources from the Mayo Clinic. For this speech, I will divide it up into 5 topics, including the definition and symptoms of transverse myelitis, following with and analyzing the statistics, then looking at the history of transverse myelitis, then looking at treatments and diagnostics, some diagnostic ways that are used by doctors to look at transverse myelitis, then following up with the awareness that is used today in the disorder. To begin with, according to Mayo Clinic, transverse myelitis is a rare neurological disorder that creates inflammation on both sides of the spinal cord, affecting one section. This damages the myelin sheath that protects the nerves on the spinal cord. This interrupts the signals that are sent from the brain to the spinal cord, which affect all bodily function. This creates many symptoms that are vary but are not limited to muscle weakness, paralysis, and bowel and bladder problems. This is mainly caused by infection or is declared idiopathic, or mainly means they don't know the cause, but it can also be caused by underlying autoimmune issues and inflammation disorders. Continuing in statistics, transverse myelitis is considered a very rare disorder with only 1,400 cases per person in the United States. 333,000 people that live in the world currently have disabilities from the disorder. This affects anyone, but there is a peak age. Any gender can be affected, male or female. The peak age is 10 to 19 and also 30 to 39. Stats vary worldwide as many cases can be misdiagnosed or misdocumented. Also across the world, many might not have the medical technology used to diagnose it and might cover it up for something else, such as a stroke or multiple sclerosis. 4 to 6 cases per million per year are documented across the across the world. In addition to the history, the earliest case of transverse myelitis was documented in 1882 by Dr. H.C. Bassane, an English neurologist. He discovered after looking at autopsies and noticed inflammation and swelling of the spinal cord in many patients. This was found later in the 1920s to be occurred due to the syphilis outbreak in that time in Europe. In 1922 to 1923, many in Europe studied inflammation of the spinal cord or described it as soft spinal cord. This was due to the smallpox vaccine at the time causing inflammation of the spinal cord, which was discovered many years prior after that, as they did not have the current medical treatments that we do today to diagnose patients properly. The term acute transverse myelitis was adopted in 1948 by Dr. Schutte K., who was a neurological physician. Since new technology has been developed, there has been many breakthroughs in medical diagnoses. MRIs and CT scans are widely used today to diagnose transverse myelitis. CT scans are used to rule out stroke, and MRIs are used to detect the inflammation in spinal cord or also rule out spinal cord strokes. There's also a better understanding of the disorder today, as many now know what to diagnose this properly and not look over it. This also leads to better understanding of the disorder and better advocacy for patients. Going on to treatments, there are very certain and few transverse myelitis treatments that can be used. There are not many treatments due to the very vagueness of the condition and being a very niche condition, and it is only classified in certain areas as a neurological disorder. Certain treatments that are used are immunoglobulin therapy or IVIG, plasmapheresis therapy, or intensive steroid treatments, usually using prednisone. Physical and occupational therapy are also very crucial in this time. Many will go through rehab, intensive rehab, and then continue physical therapy and occupational therapy through life. This helps. The goals of physical and occupational therapy are to help achieve independence for patients as much as they can. It also helps to retrieve mobility and function to the best ability of the physical therapist and occupational therapist to provide the patients with those exposures to the therapies. Recovery varies case by case also. Many will make a medium to full recovery, while some might only make a small recovery. Many are left with small to big lifelong impairments. Although there is no cure, the treatments that are used currently help to play a big role in healing the body and getting the body at least back to a medium to full recovery stage. Every treatment is vital for the best outcome. To continue on with awareness of transverse myelitis, over the years the disorder has been better understood since years stated, such as the 1800s to 1900s, when the disorder was first being understood. Since this awareness has blossomed, June is recognized as Transverse Myelitis Month. This month helps to educate others on the disorder and also brings a very big awareness side to patients and families that deal with the disorder in day-to-day life. The This Is Me campaign has also started in 2013 to 2014, which allows patients with transverse myelitis, including me, to share my story and also share their experience with treatments, being diagnosed, and the recovery they face. As knowledge increases, so is medical research and public advocacy. This has led to a very big explosion in public funding for research treatments, as there is not many available for transverse myelitis even today. In conclusion, we have discussed much about transverse myelitis. This includes the effects on the body, the history, the statistics, the treatment options available, and also awareness that is raised for patients today. Though rare, potential for life-altering changes from transverse myelitis requests a very much understanding and support from people like me and others. By educating and bringing awareness to TM, each of us can play a very vital role in understanding the disorder and bringing light to the disorder through the world. Let's not wait till you or someone you know is affected by the disorder, because even though it's rare, it can happen to anyone. For me, I thought I would never be going through something like this, but then out of nowhere it happened to me. Let my personal testimony and others through this speech be set a fire in your soul to advocate for many rare neurological disorders like transverse myelitis. Let the knowledge also inspire advocacy and education to others for this disorder. Understanding transverse myelitis can inspire recovery and lead to a brighter future disorder, and hopefully one day lead to a cure. Thank you.